Jamie, thank you for joining us today.
Thanks, Stan. Appreciate it.
Why don't we start out by talking a little bit about your background, your journey, and where you are today?
Well, it's been incredible. Actual Healthcare Solution, it's AHS, is the company that I founded, 2015, 8 years ago. And the whole idea behind Actual Healthcare Solutions as a practicing physician has been, what could we do to better support our physicians in this environment of technology pretty much dominating our day-to-day workflow? And so the adventure, honestly, of being able to determine what physicians actually do on a day-to-day basis and how they engage with patients, and helping to digitize that to make it more efficient and make it more user-friendly, and really sort of balance the power between the doctor struggling with technology to be able to practice as they've been trained to do. We think that a very high-level type of platform that can be of assistance is what we really are focusing on.
It's fantastic. And certainly AHS is already providing a lot of value for customers out there today. And tell us, when people are using the platform, what are some of the biggest value-added areas that they're working with?
Well, I think the biggest thing that the physicians and the patients are really focusing on is the streamlining of the referral process. The ability, if you think about it, of patients and physicians engaging one another is really the cornerstone. It's the backbone of our entire healthcare system. It doesn't matter how enormous the matrix is above it. In the end, that is the cornerstone foundation. And so what patients and physicians have really recognized is our ability to facilitate that patient-doctor engagement through digital technological facilitation, use, assistance, ease. And it's just enabled our participants in our beta studies to really, really say, you know what, this is really helpful to us. And that's what's been most important. And it's been very gratifying on our end, to see that the recognition is coming through.
And I think everyone in the room would agree that we certainly, when we walk into physicians' offices, we see fax machines, we see papers, we see a lot of phones. We certainly aren't there yet as a healthcare system where we're able to swipe, a phone, swipe a pad or a screen and make a doctor's appointment and refer a patient to another doctor and that sort of thing. So we're still a long ways off from a really smooth-running digital healthcare system. Would you agree with that?
Yeah, no, I definitely agree with that. And, when you think about some of the historical or current platforms that are out there, they work with patient scheduling. They're sort of network-defined. They kind of focus on PCPs. And ours is a little bit of a different approach. We're working with the specialists who essentially are the ones who are the catchers. They're the receivers of these referrals. And unfortunately, when you look statistically at some of the information, 70% of the specialists that, nationwide are interviewed essentially say the referral process is broken. It's antiquated and it needs to be upgraded. And so, I think the number is 68% of the experts basically say, I don't get any information from the PCP's office, so the patients are really coming almost like a black box. They're an individual, but their historical, background, all the information that would really facilitate the process, it's, coming across a fax machine or with a phone call, all the things that take a lot of time. So, we're really, really focusing on AI-driven physician support, almost gap intermediary capabilities, so that we empower the physicians with healthcare technology. They don't have to watch over. They don't have to be constantly, engrossed in. It literally is designed to be able to help physicians do their jobs much more efficiently.
It's fantastic. And you talked about AI, and you mentioned AI. It's a huge transformational movement taking place in healthcare right now.
Yeah.
Tell us a little bit about how Actual Health Services is using AI
Sure.
to improve the referral process.
Sure. So one of the things that happens with health information exchange is that it comes across in bits, pieces, it's piecemeal. And what the initial integrations of AI for our particular platform work on summarizing, a lot of the information for the doctors. And one of the focuses that we really try to concentrate on is how can we take what happens in the real world in the practice of medicine and use digital technology to assist that. So where the AI comes in is if I've got a bunch of reports that I'm reviewing and I'm in a hurry and I'm trying to quickly, synthesize this information, if I have a summary report or a customized report where AI can then tell me, hey, you know what, these values are off, and it suggests A, B, C, D. It's not telling me how to practice medicine. What it's doing is it's giving me like that little card that says, hey, focus on this. This might be something that we've picked out for you to pay attention to. And so that's one of the immediate applications of artificial intelligence that we've been utilizing. The other is the ability for the platform itself to navigate on behalf of the doctor and take a lot of the burden of platform navigation out of the doctor's hands. I can't tell you, literally, a classic example is for me to go from the OR to the recovery room, write a couple of orders on a piece of paper and leave is a 5-minute process. For me to go into an EMR and do or my physician extender, go into an EMR, do all of the order lists, get everything squared away, make sure it's actually taken off or interpreted by those who need to interpret it. It's such a cumbersome process. So we've really just started to take what doctors do and let the artificial intelligence take some of the burden off of that rote, repeated activity and facilitate use of our platform so that they can better communicate together, have information that's shared that is common even in advance of a patient showing up, which is all HIPAA compliant, all cloud-based, all secure, all encrypted, all the things that it has to be, so that information and patient engaging can now be synthesized as one, as opposed to being sequential or serial, right? If I see a patient, it's like, I need this report, I need that report, I need this report. It's like, now go get it. How are we gonna get it? Okay, get it faxed over. I mean, it's just so arcane. We're really trying to just break that down into a much more sophisticated process.
Yeah, sophisticated, but it's much simpler.
Much simpler.
From the patient standpoint, from the physician standpoint, from the practice administrator's standpoint.
Absolutely, no question about it.
And so fast forward a few years, once your system has been adopted by thousands of physicians and hundreds of health systems around the country, how is this going to look? What problems are we going to be seeing solved by all of this? Because it seems like it's going to make things much more efficient.
Well, I think the biggest thing is that if you look at the research, the team patient management benefits in the care of patients it's common knowledge at this point. It's exponentially improving patient outcomes, no question about it. And so if you can literally virtually create team patient management on a routine basis, what you're doing is you're actually navigating patients to the end point of effective care in a much simpler way that no longer requires that the patient go to see like 3 or 4 different doctors, figure out which one they want to work with, determine which one has the skill set that they want to work with. The idea is get the team management into a digitized format that is very easy to navigate for the doctor and keep the patient informed so that they have access to it, so they can see what the thought processes are, what the plans are, whom they're working with, what specialists have been converging digitally to be able to manage their treatment. And in that way, like any other system, data in, data out, garbage in, garbage out, quality data in, quality outcome. The whole idea is we utilize and leverage physician and patient screening of the information to make sure that it actually belongs to that patient. And we know that so many people are not necessarily technologically sophisticated as a consumer, as the patient, so we allow physicians to do it on the PCPs on their behalf. And so that's so important to get everyone engaged in the process in a system that is a very organized system that our AI navigation tools make very easy to use.
No, that's wonderful. And certainly, HitLab has been doing studies on this platform, and we've seen amazing efficacy in how it's rolled out. When you look at some of the metrics that you're achieving, what are some of the things that you can point to and say, yeah, this is really working?
I think the most measurable, because we've been working together on what can be measured, I think the most measured an important outcome is speed to care. That's it, speed to care. The ability to streamline the process of what it takes to get a patient to definitive care. And these are actually, for us, since we're dealing with specialists who, will have more bandwidth to pay for our services, and there are certainly quite a few, which we're hoping will integrate into the platform as it becomes commercially released. The whole idea is speed to operative decision-making. And that's one of the metrics that we're very much looking at because, face it, many operations go on nationwide every single day. And if we can get a far more efficient system, patients, their impact on their lives are diminished, and we have the ability to streamline the efficacy of the process.
No, that's a great point. I mean, we're seeing dozens of new types of tests, whether it's a blood test that can tell you if you have 50 different types of cancer, or 1 of 50, whatever it might be, or whether it's a new scan that's coming out that can take your CAT scan and actually tell you if you've got plaques built up inside your arteries. These sorts of diagnostics are useless if the referral takes 4 to 8 weeks because of the loss of data in a fax or the loss of data in a phone call or whatever it might be.
I mean, we see it all the time. I mean, I could give you a litany of examples, but just some basics in my world. A patient goes into an emergency room, has a both bones fracture of their forearm. There's a 2-week window in which they need to be operated on. But they have health issues, right? They need medical clearance, they need cardiac clearance, they might need neurological clearance if they fell and it's unknown as to why they fell to break their arm. So, just that whole process of trying to get that done within the 2-week window, that's where the delay in the referring and the delay in the patient information gathering has a real impact on patient outcome because bone callus formation occurs, and now we're dealing with a more complicated operation. The other one that's even more commonplace, I think is important to mention, is the vague set of symptoms that a patient might present to an urgent care with or an emergency room, describing. They're referred back to their primary care physician if they're not admitted. The primary care physician has an extender or has gatekeepers at the front door. The time to get in the door is delayed. And the ability to then refer to whatever specialist is going to actually provide definitive assessment and care. These time delays can be weeks to months, depending upon the competitive, medical environment. And by the time the patient actually has a diagnosis and a treatment plan by the correct individual specialist, the time delay can create aggravation of underlying conditions that we see all the time. It is the most incredible, we call it patient problem lingering. It is the most incredibly expensive driven aspect of the healthcare system. So our message, our take-home point is the referral system is antiquated, it needs to be updated, and our technology literally moves it into the 21st century.
It's fantastic. And if any of you are interested in more data around this, the study is actually published in these posters that you see inside the room. We have a number of studies that have been published out over the last year on those posters. Take a look at those and many others that are presented around the adoption of digital and different types of digital health technologies and their efficacies. Jamie, thank you very much.
Thanks, Dan. It's been great.
Take care.
Yep.